Hi, I'm Amanda, wellness dietitian at the Lung Health Institute, and today's Wellness Wednesday topic is fasting. So this video is going to talk about what fasting is, the different types of fasting, the benefits of fasting, and also some special considerations everyone should make before they decide if fasting is right for them. So let's get into what fasting is first. Fasting, by simple definition, is just a time period in which you're not taking in any calories. So typically, food is out, and then also most of your liquids are out. Typically, water is going to be good, unsweetened tea, black coffee. That's about what you want to limit your intake towards. But beyond that, there's so many different types of fasting, and I want to go over them today because a lot of patients think that fasting is just an extended period where you're not eating anything, and that may not be something that sounds interesting to you at all, or even something you want to think about trying. But once you hear what I have to say, you'll see there's a lot of different options. You may already be doing a little bit of fasting on your own now without even knowing it. So let's get started. We have our types of fasting here. The first one is known as peak fasting, or also known as time-restricted eating. Now, this is a fasting that you do every day, where you have a certain period of time that you're allowing yourself to eat, and then a certain period of time where you're allowing yourself not to eat, or you're telling yourself not to eat. So for most people, you may already be doing this. It's the time between you last eat dinner and you first eat breakfast. So for most people, you may already be doing a 12-hour fast, or peak fasting 12 hours every day. But when people are getting really into trying to benefit more from fasting, they tend to extend that fasting window. So maybe you only eat 8 hours a day and you're fasting the other 16. Or maybe you're only eating 4 hours a day and you're fasting for 20. So that's going to be peak fasting, and that is one of the things that we use in our anti-inflammatory initiative. We also use a little bit of intermittent fasting as well. Now, that's going to be fasting that's not done daily, but it's done for a longer period of time. So intermittent fasting for you may look like I'm going to not eat anything for 24 hours once a week, or possibly twice a week, and then on those days where you are eating, you're eating unrestricted, so throughout the day. Or you may decide to do a longer fast where it's like 2 or 3 days, but you only do that once a month. And then the rest of the days of the month, you're eating like normal. So that's going to be more your intermittent fasting. Now, the traditional fasting is more of what people are familiar with, where you fast 3, 4, 7, 10, sometimes even 14 days. And that's typically done more for medicinal reasons. And you also want to make sure if you're doing an extended fast like that, that you're doing it under the supervision of a doctor or someone who's very knowledgeable in fasting. So that's the types of fasting and a little bit about what fasting is. So let's look at the benefits, because that's why we're here. Now, the benefits, there are numerous. I could spend an hour just listing benefit after benefit of fasting. But we talk about 3 specifically in our wellness blog for today, and those are the 3 that I want to give you a little bit more information on. So detoxification. When we go extended periods without eating, our body is actually able to tap into our fat stores and break down those fat cells to release the energy from them. Now, guess what else happens to be in those fat cells? Our toxins, those things that we come in contact with every day, in the air we breathe, the food we eat, everything that is stored because the body wants to deal with it, it stores it in the fat. So when we're fasting and our body starts to break down that fat, it releases those toxins so that we can eliminate it from our bodies. So that's going to be a benefit. For the mental health, when you go a long period or extended period without eating and you're fasting, your body actually releases some endorphins. Endorphins are chemicals that lift our mood. So actually, fasting can give you better mood, can put you in a better mental space where you're able to handle stress better. And that's all really helpful when you're trying to focus on breathing and getting well. Boosting your immune system is another benefit of fasting. And this kind of happens twofold. So first, by fasting, your body is releasing chemicals called human growth hormones and other chemicals, extra white blood cells, that all support the immune system. So fasting kind of gives the immune system the tools that it needs to do its job the best. But even cooler than that, when we fast for an extended period of time, it allows our body to get rid of damaged cells. And that's important. It's kind of like cleaning house, like cleaning out the garage, getting rid of all the junk that you have that you don't want. So when you're fasting, your body actually does that internally. It's called autophagy, when it attacks damaged cells and gets them out of the body. So when your immune system isn't having to deal with all these damaged cells around, it's able to better fight off things like infections. It's able to reduce inflammation easier, which in turn will help you breathe easier. So again, just a few of the many benefits that you can get from fasting. So if you have been piqued at all in your curiosity and you want to know more and you think this is something that you want to try for yourself, I want to caution you 3 major considerations that we have listed here that can really help with your fasting journey, so to speak, or your fasting trial. So the first one is don't force it. Okay, now what I mean by don't force it is fasting should not be a stressful process. So, as you know, especially for lung patients, when we have increased stress, it's even more difficult for us to breathe easily. So we don't want to increase our stress by forcing ourselves to go long periods without food. Now, obviously, you're going to be hungry if you try this, and that's okay. You can work past that hunger. What I'm talking about is if you're 14 hours in and you start to feel dizzy and you're getting sweaty and you're having heart palpitations and just things aren't going well. It's beyond that period of, oh, I'm just a little hungry. If that happens, you want to eat something, regroup, and then you can try it again today and try it again another day. So again, don't force it. And along those same lines, build up slowly. Maybe what sounds good to you is doing more of the intermittent fasting where you're going 24 to 48 hours, a couple times a month. That's okay, but you may want to start with some of that peak fasting first and build up. If you're not already doing 12 hours, what happens? Can you get to 16? Can you get to 20? And slowly build up, because that's going to be much less stressful on the system. It's going to give you information on how you're doing it. It's going to help you with the process of making sure you stay well hydrated while you're fasting, and it's just easier to take that slower approach. And the third consideration I have, and this one often gets overlooked, is make sure you're eating enough. When you're reducing the time period where you allow yourself to take in nutrition, that means that when you are allowing yourself to eat, you need to eat more than you normally would. So if you go down from your typical 3 meals a day to 1 because you're doing some time-restricted eating, well, that 1 meal needs to be really big because you still have to get a certain amount of protein, a certain amount of fat, a certain amount of vitamins and minerals that you need every day. So we want to make sure that if you are doing fasting, on the times and the days that you're not fasting, that you really focus on getting enough nutrition to feel healthy and well. 2 more considerations if you are going the fasting route, and we highly suggest you consider it. Do your research, get a little more information on your own, and then also check with your doctor, particularly for those of you that are on medications, because a lot of times you may be taking a medication that's going to require you to take it with food. And that you don't want to just stop doing that because you're on that medication for a reason. So talk this over with your doctor, see if it's something that they feel would benefit, and then you can have that open discussion on it if you need to make any changes to your medication schedules, things like that. The other one I want to bring to your attention is that we do incorporate fasting, both the time-restricted fasting and the intermittent fasting, into our anti-inflammatory initiative. So we actually have that built into our plan, and we can walk you through that process as well. So if it's something that you're looking at doing on your journey to reduce inflammation and breathe easier, it's in our anti-inflammatory initiative, and I encourage you to check out the blog. There's a link to that anti-inflammatory initiative in there. You'll see it as AI2, and you'll be able to learn more about how we can help you reduce your inflammation and benefit as well from fasting. Have a great day.